Alcohol and other drug regulations are now in place and affect all those people who undertake a safety-sensitive aviation activity. It's important to remember that aviation is not being singled out here. Random testing for alcohol and other drugs has been the norm in rail, road and mining industries for many years. The focus of the regulations are on safety risks posed by the use of alcohol and other drugs in the aviation workplace. So anyone who has a role airside, has access airside, or who works in a landside role which may affect activity airside could be subject to random testing. During the first year of the program, we will test 12,000 people in the aviation sector who undertake safety-sensitive aviation activity. Offences that relate to Part 99 include performing safety-sensitive aviation activity and returning a positive test result, refusing or failing to give a sample, failing to provide identification when required to do so, failing to remain in the testing area, failing to stop performing safety-sensitive aviation activity where necessary, interfering with the integrity of a body sample. Testing will be carried out by trained, approved testers contracted by CASA, who are required to carry identity cards at all times. For alcohol, testers will use a screening breathalyzer. If somebody tests positive on the screening breathalyzer, then they will be required to be tested on the evidential breathalyzer. The permitted level of alcohol is less than 0.02, which is virtually zero. For drugs, CASA will be using oral fluid for testing. The tester will ask the donor to actively swab around the gums, tongue, and the inside of the cheeks until a sufficient sample has been taken. The tester then breaks the ampule, releasing a buffer solution. It then takes approximately 10 minutes for a result to appear. When the test is completed, 2 red lines should appear in each of the control line windows. If there are no other lines in any of the windows, the test will be deemed negative and the donor is free to go back to safety-sensitive aviation activity. If there are other red lines or part of a red line that appear in any of the other windows, this will indicate a positive result and an additional testing step will be required. The donor is again asked to swab around the gums, tongue, and inside of the cheeks until the swab turns blue. The swab is then placed inside a buffer bottle. After mixing, 4 drops of the sample are placed on the cartridge, which is then inserted into a testing device. A test result will be printed within 5 minutes. If the initial test results are negative, the statutory notice will be completed and a copy given to the donor. If the donor has no further obligations under the regulations, they will be free to return to work. If, however, the test is positive, the tester will take a fresh sample, divide it into 2 specimen tubes, and then label them with the sample identifier. The tester will ask the donor to remain in their presence to observe while they do this. The tester will then apply the tamper evidence seal for each of the tubes and will ask the donor to sign the seals to acknowledge they were sealed in their presence. The donor is to sign a declaration setting out the results of the test and to inform them of what will happen next. Samples will be tested to the Australian standard in accordance with the laboratory accreditation. Lab results will be sent to CASA within 24 hours. The donor cannot return to safety-sensitive aviation activity until the confirmatory tests are available and have been reviewed by a CASA medical review officer. More information on the CASA Alcohol and Other Drugs program is available at the CASA website.